so excited to see you here. I'm so excited to be able to kick off the 2023 Mental Health Equity and Liberation Summit. My name is Dr. Nadia Richardson. I'm the founder and CEO of the Black Women's Mental Health Institute, formerly known as No More Martyrs. This is our first session back in person, so we're extremely excited, back in person after the pandemic. It's also our first time doing a hybrid session. So while we have roughly 80 individuals who are scheduled to be here today in person, we have another 70 to 80 who will be attending virtually online. So every once in a while, you'll have one of our interns in the back who may ask a question on behalf of someone who's attending virtually. As you know, we've been around for about 5 to 7 years, starting off as a local nonprofit under a fiscal sponsorship supported by area partners, and then officially as our own 501c3 nonprofit organization. We've been able to make lots of strides, including the launch of our mental health counseling program, which I will share details about throughout the day. What I'd like to do right now is introduce our wonderful mayor, Randall Woodfin. He'll share a welcome to everyone here this morning.
Thank you, and good morning, everybody. I'm going to try to be as fast as she was. It's quick. Good morning to you all. Good morning to our members and I guess visitors who are online as well, who I can't see, but you can see us. I will say this. I think anytime you can do this in person, it's better than actually what happened the last 2 years. This organization has been in existence for quite some time, but the issue and topics that you are addressing and facing and dealing with works better to be in a position to collaborate and engage in person. So welcome back after 2 years of being online only. As stated, I am Randall Woodfin. I serve as mayor of the city of Birmingham, Alabama. And I want to pause and acknowledge Doc here for her amazing work, for her commitment, for her passion and collaboration and energy in this space, which is extremely important. I also see a colleague in the room, and that is State Representative Neil Rafferty, who I want to acknowledge. But today, many people know Birmingham's history, so I'm not going to stand up here and give you a history lesson. I think one of the things we talk about Birmingham in its past, we talk about breaking down barriers, and we talk about establishing tolerance. But the thing I also want to remind people, particularly as it relates to commemorating the 60th year commemoration of the movement here in Birmingham, part of that conversation, part of that intentionality was around awareness. And so as you fast forward 60 years later, being in a position to stand before you this morning, part of this is about awareness. You all have been bringing awareness, engaging in awareness for 7 years as an organization on this topic. Many of you all are from this state. I understand several of you all are not from this state. For those who are here for the first time, truly and genuinely welcome to Birmingham. You bring awareness where you are from, and so being able to come down here and pause out of your busy schedules as a collective to continue to bring awareness to this conversation of mental health is extremely important. The Black Women's Mental Health Institute, I want to acknowledge the different groups. So I have providers in this room, I have consumers, I have caregivers, and I have community members. And so to you in your individual lane and collectively, thank you. Now, some stats you all already know, but it's worth sharing with a group of people who are in the work. I'm going to call you all the choir. One is that in Black communities in particular, mental health is often downplayed. That's not new to this group. The stat I'm about to share is not new to this group either, which is only about 25% of Black Americans seek mental health treatment compared to 40% of white Americans. But I do want to highlight the reason, again, which you all are the choir, so you already know this. The reasons for that is that many are from disproportionate access to healthcare, to our innate need to push through problems, as well as this whole notion of mind over matter. I think the biggest thing you all will get out of today is that your mind does matter. And in that, the Mental Health Equity and Liberation Summit seeks to be intentional about knocking down those barriers of mental health, but also bringing care to the communities. The city of Birmingham, for the last 2 years, we've been trying to do our small part. So this display I'm doing with my hand and fingers represents a drop in the bucket as it relates to about $6 million over the last few years of addressing mental health issues in our community, mainly in partnership with Birmingham City Schools. That's not bragging, because that's not enough. But we do, as a city, believe in the work this organization is doing. We as a city do believe in you and your individual capacities and the individual organizations you represent and the work you're doing. And we believe as a city, as an administration, as a community, this issue has to continue to be highlighted. The issues of mental health, we need to continue to bring awareness. And then we need to continue to usher resources collectively at every level: federal, state, county, city, local, nonprofits, for-profits, and all entities in our community to make sure every generation has the resources they need, because today that does not exist. So I hope you enjoy this conference. I hope it bears the fruit it deserves as it relates to what's next. And anytime we can be of service, Doc, let us know, put us to work, and enjoy your conference. Thank you so much.
Thank you, Mayor Woodfin and staff, who, of course, he's hurrying off to another thing. We are going to start our first panel in just a few moments. We have two presenters who are actually en route, one who's on campus and one who is on Lakeshore. So in the meantime, I really encourage you to check out our vendors, talk amongst yourselves, network, and we will begin very, very shortly. Thank you. This is an extremely important topic and something that I'm especially passionate about as a professor and as a mental health advocate. At the university, I have the opportunity to teach classes specifically around social determinants of health, health disparities, and health inequities at the University of Alabama at Birmingham. I'm teaching 3 classes this summer, so pray for me. So this topic is very important to me because it focuses on increasing access to care, but it also acknowledges and really dissects the reason why these disparities exist. Oftentimes when we're doing programmatic interventions, it has positive direct impact with the community, but it doesn't have the long-term impact in regards to the changes that are needed. And this is where political determinants of health fall in. So what I'd like to do really quickly is introduce our panelists and jump into this conversation. We have Senator Merika Coleman with the Alabama State Senate District 19. We have Representative Neil Rafferty with House District 45. We have Kimberly Bosewell, Commissioner Bosewell with the Alabama Department of Mental Health. We have Dr. David Hicks, who is the Deputy Health Director for the Jefferson County Department of Health. And we have Tiffany Storey, who is the Director of Storeyhouse Counseling and Consulting, LLC. Thank you all so much for being here. I know it's extremely difficult to get you all scheduled at the same time. So for you to make the time to be here with us this morning is very, 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 very important. I'd like to jump into the conversation by just asking general questions about mental health equity in the state and then larger national issues. I'd like to start with you, Senator Coleman. The Biden-Harris administration has passed several different legislation acts and reports around the need for increasing mental health care access, but also truly acknowledging the crisis in care in regards to accessibility. Can you speak to how you are promoting some of those ideas and putting them into action for our state?
So great question. Let me take this opportunity first to just commend Dr. Richardson for the work that you do. You have actually inspired me to be more open about my personal journey, my family journey. So I just want to first and foremost just thank you for the work that you do. Can we give her a round of applause for what she's doing? And even bringing all of us together today. So in the Alabama legislature, of course, I think one of the major impediments outside of what's happening nationally is the funding piece of it. And the funding, I think the reason that we have challenges when it comes to funding is because of the lack of understanding when it comes to the mental health needs in the state of Alabama and in this country. And so Nadia, you asked specifically, or Dr. Richardson, you asked specifically about what I'm doing. I think a lot what I'm doing more is just telling my own story, being transparent about what I've personally gone through. I will be really honest that prior to 2020, I didn't even really understand depression. I didn't get it. Like I'm a mind over matter type of a person. Like I just feel like I could wheel my way into anything. But then 2020 happened. And prior to COVID, I actually lost my husband. My husband passed away on February 14th of 2020. And then shortly after that, one of my cousins passed away. And then one of my best friend's daughter passed away from what now we believe was one of the first cases of COVID. She passed away on March the 3rd of 2020. And then after that, 5 of my family members, after we went to the funeral for the family member that passed away, they came in from all over the country. We lost 5 family members from around the country from COVID back to back. And so for the first time in my life, I went into a depression. Having to try to deal with the loss of my husband, being isolated in the home from COVID, and then the loss of all of my family members and not even being able to be there for them. And my cousin, the first one who lost her mother, we were not able to wrap around for her. And so I think the more authentic that I am with my own story about dealing with depression, how I came out of it was because I actually went through therapy. Teletherapy was absolutely amazing for me. I had to see someone every week. So being able to be that transparent, talking to my colleagues about what I've personally gone through, talking to my constituents about what I've personally gone through, helps us with the understanding of why we need additional dollars for mental health. And it comes in every form and fashion. The last story that I will share is one of my interns. I had some amazing interns. One of my interns called me and she said, "Ms. Coleman, could you work on a piece of legislation that would require the state of Alabama to treat a mental health break just like any other break?" And I started talking to my colleagues in the Senate about that issue. Now, we did get some pushback from some folks, and we were just having discussions because people were like, how do folks not abuse that? You know, how can we have safeguards to make sure people don't needing a mental health break just to be off to go on vacation? But having the conversation is the first step to getting any piece of legislation passed, but also to getting the funding that we need. So, I mean, I can talk about lots of issues, but I think just being more transparent about our personal issues and acknowledging that all of us went through some things in 2020. And we need to be able to make sure people have the tools and the resources that they need to be the best citizens that they can for the state of Alabama and this country.
Thank you so much for that response. Storytelling is a huge part of the political determinants of health as well, because there's so many hidden histories that impact social determinants of health and political determinants of health. So thank you so much for sharing that. To piggyback on that, Commissioner Bosewell, Senator Coleman mentioned quite a bit about funding.
Yeah.
I'm interested to know what the Alabama Department of Health is doing in regards to funding for the state, but also how to ensure that all of the services are being provided in the state are culturally responsive, culturally competent.
Well, thank you very much, and I'm very glad to be here today. Birmingham is home for me, so I love being in the Magic City. And absolutely, some of the most significant structural barriers we've seen in our public mental health system really happened when we took a $40 million cut during the last proration and downturn in the economy. And what happened is we had to decide as a department, who are we going to serve? Who are we statutorily required to serve? And for us, that is the individual who is going through a civil commitment proceeding. And so we actually, for about 10 years, had really significant structural barriers where if you needed access to care, you could get a little bit of outpatient at a community mental health center, but you really had to be in crisis and have your civil rights taken away from you in order to get in one of our state hospitals. And so that went on for about 10 years. And then thankfully, about 4 years ago, we began what we call the Alabama Crisis System of Care, where we're developing services in the community 24/7 for people who are in a behavioral health crisis. And so there has been significant investment, many thanks to the governor and members of the legislature, to help fund crisis services across our state. That includes 988, which is the new 911 for a behavioral crisis. So often during that time when we were struggling with funding, people just got desperate. And so the only thing they knew to do was to dial 911 if they were in a behavioral health crisis. And if you dial 911, you're either going to get EMS or you're going to get law enforcement. If you get those two people, there are only two places you can go.
That's right.
You're either going to jail or you're going to the emergency department. And so 988 is the new number that is designed to decouple policing from a behavioral health crisis so that when someone actually calls to get help, they can go to a crisis center. They can potentially receive services through a mobile crisis team who can go out into the community. Unfortunately, those services right now are only available in 19 out of the 67 counties. And so we've been pushing really hard because we really believe that 24/7 access to public mental health services would be a game changer for everybody in the state. We've struggled, really, to be honest, with finding ways to get into communities and to get to individuals who are the trusted folks in that community so that people feel comfortable accessing those services. For me, our church we've done a lot with the faith community to try and reach out to ministers, because we know often individuals are talking to their minister if they're having a mental health issue. And so one of the things as a department, when it comes to the culturally responsive part of this, is really trying to figure out who are the trusted individuals in communities that we need to be talking to, that we need to engage, which is part of why I'm here today, honestly. Because there are lots of organizations that we need to be more connected to, in order to get to that trusted individual that then can talk to someone and say, this is what you need. For me, I often tell my story, usually in a faith setting, and kind of my joke is, if you knew the first 18 years of my life, you would be more likely to reserve me a bed at Bryce Hospital than think I would be commissioner, because there was a significant amount of violence and trauma and neglect during those 18 years. And so for me, this is not just a job, it is a calling, and it matters. I feel a great sense of urgency. As these guys know, we tried to pass a bill this year for 988 that would have generated $68 million to expand crisis services across the state, because I feel like everybody needs it now, not next year or the next. Unfortunately, we were not successful, but we're going to keep working on that, because we know just from the data from the first year of 3 of our crisis centers operating, 412 people showed up at a crisis center who were suicidal. So it is not an overestimation to say that those services are saving lives. And every citizen in Alabama deserves to have access to those services.
Thank you. Thank you so much for that.
And I just wanted to add just a point to what they were doing on the 988 and the storytelling. Now, we actually did pass it out of the Senate committee.
Yes.
I don't know where it got hung up on the floor, but we had a House member to come to the Senate committee to give her testimony.
Yeah.
We're there, about her husband committing suicide and how these services would have helped her family. And those stories, again, nobody asked a question. We just passed that bill on that. So the stories do make a difference. So we're going to keep on pushing. And of course, I support you 100%.
Absolutely. We do a lot of storytelling through the Black Women's Mental Health Institute. For most people who are familiar with our organization, you've heard my story. I am the only person on our team who's not a licensed mental health professional. I am a Black woman who's living with high functioning, rapid cycling bipolar 2. And my diagnosis came later in life. And so having to navigate certain systems as well as my own understanding of what I was experiencing led to the launch of this organization. As soon as I found myself in service of a counselor and a psychiatrist, my life changed. And I felt like so many people must be living in the dark, because me, as someone who's clearly educated, was living in the dark, right? I still had no awareness and understanding of what I was managing, and kind of wrote it off as an aspect of my personality, more so than something related to a diagnosis. Once I got that understanding, my life completely changed. So storytelling is exceptionally, exceptionally important, and I'm so thankful that both of you have already mentioned that. We are actually looking to model a project that came out of California. California conducted a statewide assessment of mental health disparities, and it resulted in a report, and that report was used to impact policy in the state. We are in discussions with the same research firm who conducted that assessment and looking to bring it to Alabama. If there are any partners in the room who'd be interested in working with us on that, we have some national partners that are going to be a part of that. And It seems to me from what I'm hearing already is that community and gatekeepers and relationships and partnerships are going to be a huge part about bringing that into fruition. So Representative Rafferty, that leads me to your question. When it comes to community partnerships, increasing awareness and increasing access, what can the community do to better support and partner with their elected officials to bring about long-standing change?
Well, that's a great question. I would say, first and foremost, particularly when we want to talk about political determinants of health in this case, then we should definitely talk about voter access and be staying engaged with the civic process and the legislative process so that we can finally get Medicaid expanded in this state. So that is a big priority, but there are serious political hurdles for that one in such a Republican-led state here. However, if we had things like where citizens could be more involved in the kind of policymaking process through a referendum or through any sort of ballot measure process, we might actually see some improvement. We know that Arkansas is just as blood red as Alabama. I don't think anybody's going to dispute that. But they were actually able to expand Medicaid because they were able to get the message to the citizens who were then able to put it on the ballot and then vote it out, where it wasn't dependent on the legislature anymore. So I think that is a good route to it. That would be a very long route in the state, but it might actually be the one that would work. Other than that, we see structural barriers to voting as well. I won't get into the history with all that. I'm sure y'all are more than informed and knowledgeable about Alabama and voting rights history. But there is a desperate need for, particularly, for all citizens of Alabama, particularly those that are affected in these communities who have those stories and can tell those stories, to share those, to inspire people to get out and vote, so that we can make policy change that way. And it would be a huge structural change for Alabama's, for funding, for services, for access to those services too. Because something else we kind of take for granted is that there's a lot of people, we have some amazing resources here in Jefferson County, but not everyone can reach them. So there is definitely an access issue as well. And it's not just, we often talk about rural Alabama quite a bit. I passed a bill that dealt with workforce, healthcare workforce development and recruitment that would incentivize people graduating their schools of the health profession schools to go into rural and underserved communities to be able to set up the preceptorship there, the final little piece of training that they got to get. And that kind of helps them establish some cultural competency, which I think we've already kind of talked about. It also gets them into the community. So it's people that they can trust, they go to church with, they see them at the grocery store, which would be ideal in this situation, particularly when we want to talk about that really important healthcare provider-patient relationship. But I mean, I can't say enough about Medicaid expansion. What we end up doing kind of in the meantime is trying to fix it through piecemeal pieces of legislation. What we found is like mental health has a huge, broad bipartisan support in the state, because I think mental health touches everybody, regardless of whether or not we're talking about it or not. But the thing is, we still want to take the big step like expand Medicaid to really kind of have some more sweeping changes for us, how that would go. And instead, we end up doing what we can to incrementally and just change the access or the availability of healthcare and mental health care as best as we can. A lot of that is just bringing more providers into the state. We have a lot of psychiatrists and other mental health providers who are leaving the state or don't practice in it. And we've kind of dealt with some of that through compacts, allowing some out-of-state folks who might be in a compact with reciprocation in other states to be able to practice telehealth and telemedicine here. We've done a lot on telehealth since I've been in, particularly since COVID, as well as dealing with self-disclosures for some of the healthcare professionals and that kind of thing, so that they can get the care that they need. And I'm happy to talk about that more if we want to. But other than that, I hope I answered the question enough, and I look forward to further discussion.
Absolutely. Thank you so much for that packed response. Thank you so much. It's so good. I'm going to tell you why it's so good. With the work that we do through the Institute, we actually rely on a concept related to culturally responsive and culturally proactive care. And what's been said already with the three of you on stage is cultural responsiveness, which is more programmatic in nature and results in short-term goals. And it's very important. That's direct care. That's kind of what we're doing through our counseling program. It's very important. It impacts individuals' lives directly. The cultural proactive work is the long-term work. That is the policy work. That is the work that's going to take some years to actually bring about, because it requires funding, it requires coordination, and it's going to require a lot of votes, right? I also appreciate what you said about voting. It's so important. And shameless plug, we have a table in the vendor section where we're selling t-shirts, and what you will find is a t-shirt from our organization that says, voting matters to your mental health. And that's because you have to vote in order to get the policies in place that will increase access. So it's not just voting to, well, voting is important for a number of different reasons, but in order to increase access to care, you have to vote. We can't stress that enough. And I also
you got to vote to get the people in place that will support the policies.
Yes, absolutely. And then I appreciate what you said about access into rural Alabama. I would like to acknowledge that one of our partners is in the room, the Black Belt Community Foundation. They serve 12 counties within the southern region, and we're looking to partner with them. We've already gone down there a number of times for different programs, for different partnerships. When we had national representatives come into the state from out of state, we brought them down there and did a bit of a tour. Can't speak enough to the work that they're doing, and look forward to continuing that partnership, especially as it relates to increasing access to care and counseling throughout the Black Belt. I would like to go to Dr. Hicks with this next question. I use this study a lot, the Place Matters study, and the work that your department has done, as well as some of the research that was done by Dr. Monica Baskin, who was at UAB but is now at Johns Hopkins. When we're speaking about health disparities as it relates to political determinants of health, what the Place Matters study found, specifically as it relates to Birmingham, is that the disparities, the greatest level of disparities, exist in communities that were impacted by such things as eminent domain, redlining, remnants of Jim Crow, and all of these things impacting school systems, access to healthcare, food deserts that result in health disparities. Can you speak a little bit more for everyone in the room about that study and how it relates to the disparities that you see in your everyday work with the Jefferson County Department of Health?
Yeah, I appreciate it, Dr. Richardson. So I want to kind of map this out. When we think about mental health outcomes or any kind of health outcomes, that's the downstream. That's the result of a lot of different things. And how do we get there? So for example, if we talk about increased rates of depression, anxiety, or diabetes, or whatever it is, then you got to figure out what caused that. And let's step back. And we have we call the determinants of health. And those are the things like access to education, the built environment, all those things, and where we live, work, play, worship. Then let's step back another level. Well, what drives those? Well, fundamentally, we're talking about, and this is what we consider, some people call the political determinants of health. These are the policies, the laws that are enacted. And that's kind of what this panel talks about. And let's go back a step for that. And the really fundamental root cause are the systems and structures in place in society that leads to those things. And that drives things. So you have influencers like racism. You have ageism, sexism.
Yeah.
These isms that then lead to policymakers or people that enact laws and how they think and have historically thought about this is what the needs of the community. And then you have those kind of downstream effects. So when you see it from a historical perspective, you look in, for example, in Birmingham, where we're sitting at right now, you have policy as an example. You talked about redlining, other things, that because a policy was put in place, things for segregation, then you have some collateral and residual damage that's generational down the road. So we oftentimes we'll talk about the determinants of health, and yes, those are important, and we'll focus on like you need access to education, food deserts, absolutely. But imagine if we can do system change and rethink all the things. But honestly, I work, as a local governmental person, a local health department. We inherently have power because we're a governmental agency. What do we do with the power? Okay. Sometimes we can go with the power that we inherently have and say, what do you need? Would it be radical if we gave up our power to the people in the communities that have the lived experience and say, you know what you need. We don't have to tell you what you need,
Right.
but we have the resources. We can't hold the resources and tell you what has to happen because it's our way. That's a radical different way of doing things, but we have to recognize the historical things that have happened. We have to then figure out, are we going to stick with surface level change? Or are we going to get to the deep structural things and challenge the systems that we're in? And that is policies. So it would be wonderful if now, as we're trying to change policies or have new policies, that we have the community involved to be a power broker and say, this is what we want. Let's have equitable conversations to say, we don't want to repeat what we had in the past.
Mm-hmm.
So let's deconstruct some things. Let's rework some things. Mental health is important. We need to value that. If it's important for all of Alabama, well, Medicaid expansion is something we have to figure out how to do collectively, if that's not a priority. So we have to have an honest conversation with ourselves. And then what are we willing to do about it? What are our institutions willing to do about it? What power are we willing to give up for the people that have not been given the power?
That's real.
That's what I'm saying.
That's what you're saying, huh? That was so good and so affirming. When we started this event 7 years ago, one of the things I was very adamant as a professor, as someone who travels around, oftentimes I find myself in rooms with nothing but PhDs, right? Nothing but elected officials, nothing but individuals who are decision makers, and who's not in the room are the individuals who are going to be impacted. So when structuring this event, we were very adamant, even though this stage is involved, showcasing a lot of the elected officials. We have artists that come here. We have community organizers that come here. We have individuals who are living with a mental health concern that come here and they speak on this stage, because we need to hear all of those voices and we need to work collaboratively to bring about the change that you're speaking to. So I so appreciate that very, very much. And you mentioning that, to me, it's very affirming, and I hope it's very empowering to every single person in this room to know that your voice matters. And if you should be invited to the room, and if you're not, go ahead and go in the room anyway, right? You know what I'm saying? Because you could do that too. You could make sure that happens. Miss Storey, I would like to, well, first of all, let me say this really quickly before we go on to Miss Storey. Dr. Hicks, we'd like to thank the Jefferson County Department of Health and the fund that was used through partnership with the Community Foundation of Greater Birmingham to serve as a sponsor of this event this year. So we so appreciate you in supporting bringing this about. So thank you very much. Miss Storey, one of the things that was mentioned already is access to care, specifically even telehealth and the importance and significance of that. Can you speak to some of the policies that have passed related to that and how it impacts the clients that you serve, especially those who are still managing mental health concerns from after the pandemic?
Yes, thank you so much. Glad to be here. One of the things that our congressman mentioned was the Compact Act. And so recently there was some legislation put in place for states to be able to collaborate so that a mental health provider such as myself would be able to provide access to counseling or counseling service to individuals who live in community who may have limited access, right? So if you live in a rural area, if you live in a state where there may not be as many clinicians in your state, then we're able to provide counseling services, not just in our immediate communities, but across state lines, right? So if I live in a really red state or a predominantly white area, and I am an African-American woman and I'm dealing with issues that are culturally unique to me, I might want to consult with someone who actually understands my struggle, right? And who can culturally identify with me. And so the compact allows us to be able to provide those services across state lines. And so there are multiple states that are part of this compact. From my understanding, it has already passed, and we will see it go into effect towards the end of this year, beginning of 2024. So me as a therapist who's licensed in Alabama, as long as I have the highest level of education, as long as I have the right credentials and I've done what I need to do to satisfy licensure, I can provide counseling services in Georgia. I can provide counseling services in Washington, D.C. or California. I'm not originally from Birmingham. I'm a transplant. My family moved here when I was much younger. And so I have family in Mississippi and California. Unfortunately, I don't think Mississippi has joined the compact just yet. Hopefully they will. But I have family all the time say, hey, you know, I see that you're advertising, you're taking new clients. I have someone that I want to refer to you, and I've had to decline and say, you know, I can't service them with them being in Mississippi because I'm only licensed in the state of Alabama. And if I ask questions as to like, well, why do you not, want to send them to someone in the community? Sometimes it's because the community is small and everybody knows everybody and they go to church, right?
That's right.
Together, they go to the grocery store. And so that small town, it feels like you don't have safety, right? And then sometimes it's because people don't look like you. So, legislation such as the Compact Act has allowed people in areas to be able to access services that many of us in bigger cities have access to.
Absolutely. Thank you so much. I do want to mention very briefly, specifically because Commissioner Boswell, you mentioned 988. I would like to share just in regards to the structure of our organization. We have board members in various states. I would like to acknowledge Sherry Tran, who's an attorney here from Atlanta. She's on our board. But one of our board members is actually Lenata Williams, who is the Deputy Director of Access Helpline, and she's in DC with the Department of Behavioral Health. And she was actually a big part of bringing about 988. So I was extremely excited about, it coming about in Alabama and some of the promotions that were taking place here, because I kind of got a front-hand view of what she was doing to bring all of that about. And those are just some of the types, if I should pat myself on the shoulder a little bit, of wonderful individuals who support our organization. She's been a big part of why we've been able to speak at a congressional briefing in DC, and why we have such a network in DC. And I'd also like to piggyback on something that you shared, Ms. Storey, just in regards to access to care. We've got a great partnership with you as well. If you want to go to our physical office, it's actually located in the Olive Branch Center, which she and her husband run in Eastlake. And one of the things that we are doing with her is promoting our internship program. That piggybacks a little bit of what Representative Rafferty mentioned in regards to the low numbers of clinicians of color and then clinicians who are trained in cultural responsiveness. And so we are actually supporting interns in that. And so the interns that you see kind of running around are actually master level graduate students who are working towards completing their practicum hours and then working towards full licensure. So if you see them, pat them on the back and let them know that they're doing a wonderful, wonderful job. I want to also say, are there any questions in the live stream? And if there are any questions that you might have, we're going to open Q&A in just a moment. So write them down, and we're going to get going a little bit on that. I would like to just ask one more question of everyone who is on stage. What were some of the closing thoughts that you might want to share with participants today on how they can engage you and support the efforts that you are working on currently that will support access to care holistically, but also specifically mental health?
Where are you starting?
Any one of you.
Sure. Well, I'm easy to get. I'm on social media. You can just Google my name. I'm the only Merika Coleman, Merika Coleman. I'm on all social media outlets. People inbox me with issues. Matter of fact, some of the biggest pieces of legislation that I've sponsored have come from community people that may have tagged me in something to make me aware of an issue. But I do have a couple of thoughts that I wanted to mention based on what my colleagues said as it relates to access to voting, and also 988, and also what Ms. Storey said about telehealth. The voting and getting people in place that care about your issues, whether it's mental health or anything else, is so important. 988 was a fee. It was an additional fee. So for some political folks, they don't want to vote for a fee or a tax. So you got to try to, this is not a partisan thing, so I'm trying not to be partisan. So you have to put people in place that no matter what the issue is, they'll be willing to support. Telemedicine. was one of the issues that came up. One of our lobbying groups was lobbying against telemedicine because that creates competition to those practitioners that are here in the state of Alabama. Then they have to compete for the services with other folks. But again, it's one of those times I actually told my story again about how, the telemedicine and the telecounseling actually helped me. So again, it is so important. I know we care about this issue, but you have people in place that will work across party lines, that won't listen to the noise, because lots of elected officials think about one thing, the next election. Right? So we have to have more people in office that think about what's best for the community, whether they get reelected or not. So again, you can reach me on all of those social media outlets and Google me, and you can call Montgomery and they'll get you in contact with me.
Absolutely. Voting is essential. I just can't emphasize that enough. Being engaged in the political process, talking to your members anytime you get the opportunity. It was fascinating to see how many members, whether they were Democrats or Republicans, actually had an experience in their own life, either with a family member or a friend. That was the game changer when we started seeing additional funding come into the Department of Mental Health, was when across the board, people were talking about and experiencing those issues and telling a story about their neighbor, their loved one who wound up in the ER and got booted out and then committed suicide. I mean, there are so many stories. So again, that storytelling is huge because people can hear that message if they feel like they are connected. Everything, honestly, happens in relationships. If there's anything that I would say as Commissioner of Mental Health that I've learned, is it really seriously is all about relationships. We work really hard to build really strong relationships with members of the legislature. We also work very hard to build relationships with the people we serve. And anything you can do to tell your own story, anything you can do in relationship with others is huge. It's just like my situation. I've been doing therapy since I was 30 years old. And then all of a sudden at 50, I took a nosedive. I was having a lot of trouble. That was the first time someone said to me, you have PTSD and you just got triggered. And that's why you're going down this rabbit hole. Nobody talked to me about trauma or what happens when little people experience trauma. There's a whole conversation around trauma that we need to be having, because that plays into your mental health, your anxiety, your depression, and all of that. And so as much as you can share your story, as much as you can connect and collaborate, all the better.
He was deep in thought there.
I'm processing everything she said. Honestly, I don't think I have too much more to offer than what my colleagues and Commissioner Bosewell has said here. Particularly when we want to talk about sharing the story. I mean, there's something about mental health where, I'm a veteran and we often talk about, injuries seen and unseen. And we need to talk about particularly that trauma piece and talk about mental health care as an unseen injury or an unseen need that might not be apparent or it's not on the surface. We all know this. But I think the part that you kind of spread awareness, particularly on a community level, would be like you're talking about sharing your story, sharing your vulnerability, because I think a lot of people are worried or concerned about
the stigma.
The stigma of it. Exactly. Yes. Thank you. That's the word I was looking for. So, that's how you make that change on a one-on-one level and make sure that people are, know the importance, or that they're not alone. I think that's the important part, that people just know that they are not alone, that their story is that there's somebody else that's gone through this. And then, you are, clinical folks, I imagine, at least most of you are. And I imagine that y'all would, also be more than willing to share resources and that kind of thing with community members as well, to make sure that they know where they can go and get that access for those services. But really, I don't think I can add too much more than what's already been said. So I'll just leave it at that.
Just one statistic. So July 16th will be the 1-year anniversary of 988. So it launched July 16th, 2022. In Alabama, in that time, we've had over 45,000 contacts.
Wow.
That's calls, texts, and chats. Just saying.
I would like to add something too to piggyback off of some things that you mentioned and things that you said. Nadia mentioned that the Black Women's Mental Health Institute is located inside of the space that me and my husband own. And even though I have my own private practice, my husband is a massage therapist, and both of us come from families who have experienced trauma, who have experienced addiction, who have experienced mental illness. And so our vision was to be in a community that does not have access. So we chose Eastlake. But it was also to create a place where there was collaboration, and we could also bring access to services that people wouldn't typically have access to. In the Black community, we don't always have access to massage therapy.
That's right.
My husband
That's
worked 13 years for the Marriott at Ross Bridge, and when he was there, statistics said that 90% of the consumers that actually utilize massage therapy services are white women, right? Between the ages of, I think, 35 and like 55. And so when we decided that we would branch out and start our own massage day spa, we watched all of his clientele go from that statistic to being majority Black women who were professional, who were also experiencing a lot of stress in their lives, right? And so we were able to create a space in a community for people who felt comfortable, because one of the things they said is that they didn't have access to that. So when we expanded to the Olive Branch Mind and Body Suites, it was to create not access just to the community, but make it easier for clinicians of color to be able to provide those services without going into debt. So it's a co-working membership-based space that allows you to come in, work in a fully furnished office, and you pay when you work. And so that allows you to make money. It allows the community to have access, and it allows us to bring in different service providers. So we have an esthetician, we have a massage therapist, we have mental health counselors, not just the Black Women's Mental Health Institute, but myself and a few other practices. But we're also out there recruiting, dietitians and nutritionists, and
love that.
Anyone who specializes in alternative or complementary medication. We can't replace doctors and nurses; they are necessary. But our community also has a very conflicting history with the medical field, right? Mm-hmm. So how do we provide them access to services that support their mental health, but they may trust those services a little more? So when I am sitting in front of a client who really needs medication, because they trust me, I can say, it's time to call your doctor. Mm-hmm. It's time to have that conversation, that this is something you can't just power your way through. And because I live in that community, because I work in that community, I go to church in that community, I shop in that community, I'm trusted. And so, I think it's important for us to recognize that even if we're doing the same thing, we are not competition. We are collaborators to a social goal, right? And so that space was to create collaboration and to help push the needle forward when it came to mental health and improving mental health outcomes.
Thank you so much for sharing that. And if I could do anything, I would love to recommend that you check out Ms. Storey's facility. It's really very dynamic, and it's really also a very beautiful space. You were very intentional about colors and making it calm and soothing. But everything you just said is directly connected to local determinants of health, and I appreciate that. I also want to share that Medicaid has been mentioned a number of times today. During one of our sessions, Executive Director Robin Hayden with Alabama Rise will be up here to have that conversation as well. So you'll hear a little bit more about why that's so important to healthcare and also specifically mental health. We're going to close out with one more question for Dr. Hicks, and then we'll open it up for questions from the audience and participants. And I literally came up with those off the top of my head just because storytelling has been mentioned so much. And so I want to share two quick stories. and just ask you a question. So with the services we provide direct mental health counseling, but also advocacy. One story that we had is a woman who was sent to us. Someone engaged her out in public, and she was clearly managing something. When she came to us, with us providing direct mental health counseling and talk therapy, we noticed that it wasn't going to be beneficial because she needed pharmaceutical intervention, right? So we had to send her to a psychiatrist first, get her in a stable position before she could utilize any talk therapy. Once she went to a psychiatrist, that psychiatrist was able to coordinate with us and said she actually needs to detox, right? And one of the reasons she needed to detox, we oftentimes think of it as substance abuse and some illegal substances. What it was is that she was in a very low socioeconomic status, had experienced episodes of homelessness. And when she did go to facilities and get support, one facility would give her medication, then she go to another facility, they give her medication.
Yep.
They go to another facility, they would give her medication. And because those facilities were not coordinating with her, she was on a number of different medications that she did not need to be on. She was also the mother of a son who was lost to gun violence, and it's the Offenders Alumni Association that's here, and I'd love for you to be a part of this conversation a little bit later, because I know the valuable work that you're doing as well. So she was managing trauma related to that. When she would go into distress and sometimes go off her medication, we do advocacy to find out why she couldn't have access to it, right? So we get her to facilities where she could get some of her medication for free once she was placed on the proper medication. Then she didn't have transportation, and sometimes the buses were not reliable. So we would Uber her to some appointments, right? Then she ended up going off of the medication again and had an encounter with law enforcement and was issued an arrest warrant. We were able to go to court with her and advocate that she not be locked up because she needed support, and we were able to provide that support. These are some of the stories that we have, because it speaks to things like the criminalization of mental health. The fact that so many individuals who are managing mental health end up in the prison system versus getting the integrated care that they need. Another story, specifically as it relates to Alabama, is a young woman who was at a university, and she identified as LGBTQIA+. She was not getting support from her family, so she was very distressed, and she was able to come here and get support from us. However, you know what she spoke to? She spoke to the fact that there were policies being passed in our state that were not supportive of her and her identity and how she was navigating the world. So all of those things, again, connect to policy, they connect to disparities.
Yes.
How is the Jefferson County Department of Health managing those kind of instances, which I know you encounter in your work?
Wow, that's a lot. Well, I think we're actually going through a transition now where we're looking at, from a strategic perspective, how can we use our resources as a public health agency to assure access to services, fill gaps. And so, I think one of the things is that we, as you all know, we have a lot of phenomenal, and you represent organizations, you have nonprofits, you have, formal organizations, that get funding. And it's almost, there's a piecemeal approach oftentimes because we're not as integrated. And oftentimes a lot of agencies or organizations are competing for funding. So I'm competing with someone down the street to get the grant dollars, and we're hopping from grant cycle to grant cycle to just do things, or hoping for some philanthropic contribution. And it's not as coordinated. So, in my opinion, some of the expertise that we are hoping to do is do something we call like a gap analysis. So you look at the whole landscape of whatever you're trying to solve. Look at the whole continuum of care, and how you laid out. It started from this point, and then there was gaps that weren't being met, and then this person ended up, unfortunately, the first example of being incarcerated. Well, how can we prevent that cascade from happening? And it's because sometimes we're not seeing what the other person is doing and partnering. So if I know that you're doing phenomenal work down the street, how can we wrap around all our services around that person, direct them there? That agency does what they have to do, then they send to the other agency, and everyone knows what each other's doing, so that we don't lose people through those gaps. And so, to me, that's how we can try to use our resources to identify the gaps. So know the playing field that you're with. Identify the gaps, can have the convening so everybody's in the space that can share what they're doing.
Yeah.
Right. We've done this, with maternal, health,
Yeah.
Infant mortality type of work. And you just level the playing field, and we're not trying to compete with each other. And then you then have to give the community the resources and know how to navigate through the system. Some people need more hand-holding than others. So that, and then ultimately, we don't want to get to that incarceration. I mean, I used to, I had a part-time job where I was a doctor in the county jail. And you know how many people have mental illness, so their treatment was incarceration.
Right.
Yeah.
Right.
And so now they're in this cycle of just, I'm getting incarcerated again and again because the system let them down.
Right.
The resources weren't given to them. So to me, I think that's what we all need to work together. So we have like-minded folks here. We all can just bring everybody in and demand change, engage, stay engaged, and have the multiple levels. We talk about political, governmental type, and that's one thing, and the voting. And there's other things you can do beyond even that. What about your job? There's the policies in your job. Do they offer a mental health day?
That's the
Right? So you have expertise. So no matter what spheres of influence you have, so if it's where you worship, what are we doing in the mental health space? Or so we want to normalize this and then bring everybody together and let's figure it out together and take away our egos, take away, I want this grant dollar over your grant dollar, because the community's been suffering because we haven't been able to figure this out.
Well, as Dr. Hicks was talking actually even earlier, and then you just expounded on that when you were talking about getting everybody in the room. Some years ago, I passed a bill, the Domestic Violence Fatality Review Team. And it came to me because some of the work that I was doing. And when we put that review team together, it had all of these various practitioners in addition to folks who had been abused, but also abusers. And as you were talking, just for both of you all, do we have a statewide committee or a statewide something? Is that something that my colleague and I can sponsor to put together something like that domestic violence fatality review team where you have all of these various practitioners that is supported by the state? Then what ultimately comes out of that is policy. We've done that on human trafficking. Put all of those folks in the room and then come up with the policy. And we give the Governor Ivey credit for, what came out of her human trafficking task force. Do we have something like that? Or is that something that the two of us can be working on?
I don't think we do. We tend as governmental entities to operate a little bit in silos. And so I don't think that there's a comparable group of people working together around mental health policy. We have different groups, but not one that would be as comprehensive as I think you're suggesting in what you described.
Yeah, there's a model. So you have the homeless continuum, which came out of Hurricane Katrina, right? So, and I worked with homeless until recently, and so I was a part of that continuum, and there was a mental health focus in there. But I also partnered with the children's policy.
Yes, children's policy, yeah.
Right, and so they were kind of spearheading the trafficking, and there's a huge emphasis on mental health in there. So you have all these models that do have a component of mental health,
but nobody's focusing.
But nobody's that's focused directly on mental health.
I think we have a task. I think we have a task. Look what's coming out of your summit.
And we will be all in it. All right.
Yeah.
We're in full support. I know we started this session a bit late because of technical difficulties. So I'm going to ask if there are just a couple of questions. We won't have time for any extensive questions. Are there any really pressing questions? Yes, please.
Ms. Storey, where are we on the Compact Act? Are we closer to that becoming open here in the state where clinicians licensed here in Alabama can cross state lines?
Yeah, so you can actually go to a website. I want to say, I know you can access it through the American Counseling Association. If you just Google Counseling Compact, there's a website that allows you to track the progress. They have a map of the states, which states are a part of that compact, which states are in the process of trying to join that compact. If I'm not mistaken, the compact was passed. Now I think they are just organizing how to roll that out, right? And so the website, the last time I checked the website, it said at the end of 2023. So we're in 2023. So we're anticipating maybe in the fall and then maybe winter, January, February, that we will be able to apply, because there's going to be a process to apply to be able to offer those services. And so I encourage you, if you're a clinician, to just go on Google Counseling Compact, or go to the American Counseling Association. They'll have something there that will take you there, and then you can click on the specifics for your state where you are in that process, and there will be information about how to be a part of that or how to take advantage of offering services across state lines.
Do we have any questions online? We're good? Okay, we're good. So thank you so much to our panelists, our open panelists. I see this as very powerful. I also see it as an open invitation for collaboration, and we will be doing that. So we will be in contact with you very, very soon. Some of you I know we're already working with, but we're going to make this happen. And I'm very excited about the change that we are doing already in the state and beyond, and the change that we are going to bring about even more. So thank you so much.
Thank you.